everybody, it's Shelby. I hope you're having a great day, a great week, because it's beautiful outside. Today's topic is sitting posture. Sitting posture is super important because we sit every single day, multiple times a day, for extended periods of time. Many of us know that sitting posture is important, and some of us forget the way that we're sitting. So today we're going to go over all the do's, the don'ts, and what to do if you are suffering from bad sitting posture and how it's affecting your body. In this photo, you can see her proper sitting posture, which entails her feet flat on the floor, so her body weight is evenly distributed between her legs. Her hips are even, so therefore she has proper sitting posture and it's even across the base of the chair. Her abdominal muscles are braced. Her shoulders are even. There isn't one higher than the other, or her arms are not in an uncomfortable position, as well as her chin being parallel to the floor and her head is over the weight of her shoulders. So her head doesn't have any tilt moving it side to side or any rotation turning her head left or right. This is a side view of proper sitting posture. Here again, you can see her feet are flat on the floor, but I also really want to point out that her knees are bent to a 90-degree angle, as well as her hips also at a 90-degree angle. You want to make sure that you don't have to be exactly precise, but you should be very close enough so it provides an even distribution between the weight of your body in every single joint, from your hips to your knees to your ankles. This is important in making sure that you don't flex or arch your back to overemphasize the curves, because that will lead to improper posture, putting you in a bad position. But I also want to note that from here you can see that her head is as right over her shoulders. It's not too far forward. It's not bending down. It's not looking up. The weight is evenly distributed. In this photo, you can see a model spine right behind the patient. This is just to give you a visual of what it looks like inside of your body. There's proper positioning of her pelvis to where she's sitting at the base of the chair. Her lumbar curve is adequate, her thoracic curve is adequate, as well as her cervical curve. This entails proper biomechanics of the joints, and there's no overemphasis on one compared to the other that would cause more stress in her body. Having that extra stress in the body is going to lead to a plethora of things that you do not want to have. I want to take a second here to describe exactly which part of your pelvis that you are sitting on while you're sitting in a chair. At the bottom part of your hips, there is a bone that has large prominences on them called ischial tuberosities. This is where you should be sitting. They're commonly referenced to your butt bones. This is the part that should be sitting on the base of the chair. This ensures that the pelvic is in proper position and you aren't turning or rotating your hips in a manner that's going to cause pain or stress. I'd like to take this time to do a little pop quiz. I'm going to have an arrow point to a region of the spine, and I'd like for you to correctly identify it. I'll give you a couple seconds after I ask the question, okay? Let's begin. What is this area of the spine called? Right, it's the cervicals. There are 7 vertebrae in your neck. What is this spot of the spine called? Right, it's the thoracic. There are 12 vertebrae located in this region. What is this region of the spine called? Right, it's the lumbar. There are 5 large vertebrae here in this region. Good job. This is an example of bad sitting posture. At first sight, I'd like you guys to see the very, very large thoracic curve that she has in this position, as well as her neck is also flexed forward. This is bad sitting posture. Okay, let's start from the bottom. Where she's sitting is not on her ischial tuberosities. Her pelvis is rolled, so she's actually sitting on her tailbone. This is bad biomechanics. This is going to lead to more aches and pains, starting from your low back to your hips, all the way down to your knees. This can cause issues moving forward, especially if you sit in this position for extended periods of time. She also has an exaggerated thoracic curve. By doing this, she's putting her shoulders in a forward rounded position. So now you're not only affecting your middle to upper back, but you're also affecting the shoulder girdle as well as her arms. You can also see that her neck is flexed forward. This can cause neck pain, headaches, migraines, moving on into the shoulder girdle as well. This is going to cause a lot of pain in your neck and upper back as well. This is no good. Here is a close-up image of her hips. Here you can see that her body weight is rolled onto her coccyx as well as her sacrum. This is commonly to what you refer as the tailbone. When her weight is distributed here rather than the ischial tuberosities, it's going to lead to muscle tightness and pain. Now I'm going to show you some examples of bad sitting posture in which we should avoid. Here you can see that her feet are not flat on the floor. Her knees aren't accurately bent, which is therefore extending her hips, which is making her roll back onto her tailbone. This is no good. Here you can see that the patient is sitting on her leg. With this rotation of her hip to putting her leg underneath her other leg, this is going to cause an unequal weight distribution between the lower half of her body. This also causes disruption of the joints that connect the spine, meaning the lower back, to your hips. As well as in this picture, you can see that the patient has rotated her leg, altering the mechanics of her hip joint to put it underneath her other leg. And with her leg fully flexed and bent forward towards her chest in this position, it's going to alter the biomechanics and joint function of not only her hip, but as well as her knee and her ankle. If you are in this position for an extended period of time, this is going to alter normal motion as well as muscles and ligaments being in this position. Here, I'd like to point out that the patient is rolled onto her tailbone rather than sitting on her ischial tuberosities. This is going to affect weight distribution as well as the joints in her hip. You can also see that her knees aren't bent to that 90-degree angle that we're looking for. So by inhibiting that bend in the joint, your body weight and distribution is going to be way off. This position is very common. In fact, we find ourselves gravitating forwards after we've been sitting at our desk or sitting in a chair for an extended period of time. The longer you sit there, the more your body weight is going to want to shift forward. You can see that she has an exaggerated thoracic curve, which is therefore rounding her shoulders forward as well as bringing her head into a forward position. You can see that instead of her body being aligned in a straight line, it's drastically moved forward, which is going to affect joints in the neck, upper back, mid-back, all the way down. Having proper sitting posture is vital to spinal health. If you find yourself in a forward flexed position, as we saw in the earlier picture, your body's going to feel stiff and sore and achy coming out of that position. Your body knows it was incorrect, and sometimes we forget, which is okay. But we'll notice that when we try to stand upright, things feel different and things feel weird. So my job as a chiropractor is to scan the spine in its entirety to look for those areas of dysfunction. When there's a misalignment within the bones that make up our spine, it may cause interference on the nerve that's leaving that spine. We know that the brain communicates to the rest of our body through the spinal cord, in which the spinal cord travels through the vertebra in our back. So if there is impingement or a miscommunication because of that pressure on the nerve, it might cause disruption in normal bodily functions or normal body activities and actions. So as a chiropractor, I look for those areas of dysfunction, to which we refer them as subluxation, and we put them back into place in a correct and gentle manner so that your body is able to function fully to its highest potential. This patient is texting. I'd like for you guys to look at her spine and you tell me if this is proper position or improper position. You're right. This is the wrong way to sit. You can tell that her head is flexed so far forward to look at her phone that it's going to affect the joints and the bones in her neck, which is going to lead to pain, and over time this may cause a chronic issue. In this patient, you can see that not only is her head flexed forward, but she's not sitting on the proper part of her pelvis. When her weight is distributed to her tailbone, it's going to cause issues in her hip joint as well as in her upper neck. Here you can see proper sitting posture while texting. Her spine is in a neutral position because she has brought her phone up to her eye level and not brought her eyes to her phone level. Here, I'd like you guys to look at this patient who is typing through her computer. You can notice that her head is looking down. She's looking down at her screen so she's able to see and do her work. This is bad sitting posture. Here you can see that the patient is looking up at her computer screen. This is causing an excess curve in her neck, which will also lead to issues moving forward. Here you can see that the patient has moved the computer screen so it's right in front of her eyes. She is not having to look down nor look up, and she is not compromising her spine this way. This is proper sitting posture. Hey everybody, I hope you enjoyed this video and I hope you gathered a lot of information on the do's and don'ts of sitting posture. I'm really excited to see you guys start implementing this into your daily routines. Not only is it beneficial for your bones, muscles, and ligaments, but it's also very important for your spinal health in its entirety. Thank you so much for tuning in, and I'll see you next time.